Okay, so we heard there in Karina's story from Dr. Samir Sinha. He chaired the Health Standards Organization's technical committee that drafted the proposed standards, and he joins us now live from Toronto. So Dr. Sinha, thank you so much for making some time for us this morning. We want to get right to it. We heard there in Karina's story about how in those first few months of the pandemic, more than 80% of Canada's COVID deaths occurred in long-term care and retirement homes. How important is it, in light of what we've just been through, to provide a clear blueprint of draft national standards for long-term care?
Thanks, Hillary. It's just incredibly important because I think all Canadians now are aware of the state of long-term care in Canada. There's no province or territory that's gotten it right. We know that the system has been grossly underfunded for years, that we haven't had the level of oversight and the level of standards that we actually need to make sure that we are providing the best long-term care that some of our most vulnerable Canadians need. So this has absolutely, I think, opened our eyes to what has been needed. And we're really thrilled that over 18,000 Canadians have participated to date in telling us what they think needs to be in these standards. And today, now we start a public review. We're inviting all Canadians to take a look at what we have, tell us what we have right, tell us what we need to improve on before we finalize these standards before the end of 2022.
And can you give us a couple examples there of what you have heard about what people would like to see in these national standards, these proposed standards, and how they even go beyond the current ones, which were just last updated in 2020?
Yeah, these ones are far more comprehensive now, and they really have a whole reorientation to the idea of what is really safe, high-quality care that is truly resident-centered. So putting residents at the heart of this, saying what does it take to provide them safe, high-quality care, but also thinking about the workforce. The previous standards didn't have much to say about our frontline workforce, but we know that the conditions of work are the conditions of care. And unless we actually make sure that we have a well-supported, resilient, and competent workforce, then you can't even provide good care at all.
And, you know, there was something that stood out to me in Karina's story there. We heard from some family members who had loved ones in these homes. And one of the things in these proposed standards talks about giving residents more autonomy and making sure that we get that balance right between keeping them safe, but then also making sure that they live with some risk, that they are not barred from seeing visitors. Talk to us a little bit about that and about what led you and your team to start to look at that.
Yeah, so when we were doing our national consultations, we had over 16,000 people participate in our survey, and it really started to get these nuances of the duality of long-term care. The idea that these are both places where people live and work. This is where we have to think about individual needs, but also how do we standardize and how do we also protect, the collective whole. And so this is why we really reoriented the standard around a human rights approach and a resident-centered approach, saying what is it that residents need? How do we actually provide that care? And how do we allow residents the right to live with risk, but also provide them the overall safe, high-quality care they need? So it really is a careful balancing act, but we're hoping that we got that nuance right in what we've written. But this is the chance, again, for all Canadians to tell us if we got it right or what we need to improve to get it to where we need to be.
And as is pointed out in these proposed standards, that healthcare and long-term care, this is provincial and territorial jurisdiction. But of course, a hope here, I would imagine, that the federal government also participates in that. So talk to us about that, about what it's going to take to get, multiple levels of government involved here in order to actually see these through.
Yeah, but so we know that in 2020, the federal government said that they want to work with the provinces and territories to develop new national long-term care standards. And while long-term care is largely a provincial and territorial jurisdiction, we know that the federal government has pledged $3 billion to support the implementation of new standards. They've talked about putting together a Safe Long-Term Care Act, and we're hoping that these standards that we have developed, will actually become the basis of future legislation and future investments that are needed both federally but provincially and territorially to actually advance this. Because ultimately, standards are just standards. But if you actually then put the money and the effort into actually making them a reality, we can actually see what we're putting on paper come to life.
And just finally, Dr. Sinha, and I don't have a lot of time left here, but there was a sentiment there within Karina's story that maybe it's now or never, that there's been so much attention placed on long-term care in Canada over the past 2 years that it's important that we move forward on this now. Do you think that that is true, that this is really a good opportunity to start to look at this more closely, and that if we don't move on it now, we might lose that opportunity?
Absolutely. If the deaths of over 16,000 people in these settings has not actually moved us to finally do what we need, I don't know what will. So honestly, this work is a work that people are engaged in because we care. We need to get this right, and this is our chance. Let's get it done now.
Okay. Dr. Samir Sinha, thank you so much for your time this morning.
Thanks for having me.